Colleagues, I'd like to suggest that no conversation about depression in older adults is really complete without a consideration of bereavement and terminal illness. All of us know that the loss of a loved one is particularly likely to occur later in life, and that attachment bereavements can become an occasion for the development of major depression, just as patients who are confronting terminal illness very frequently experience some degree of depression. In recent years, we've learned a good deal about the intersection of major depression in older adults with issues related to bereavement and with issues related to terminal illness and its management by palliative and supportive care physicians. Just on a personal note, I would like to say that one of the most enjoyable and for me gratifying parts of my own clinical practice has been the collaborative care that I've undertaken with colleagues who specialize in palliative and supportive care medicine. There is indeed a profound intersection or interplay between palliative and supportive care medicine on the one hand and geriatric psychiatry, geriatric mental health on the other. I'd like to cut to the chase here and really emphasize, I think, where the science has been most impactful. We've learned a great deal about what has come to be called complicated grief, or in the parlance of the International Classification of Disorders, the ICD-11, prolonged grief disorder. We know that about 10% of people across the life cycle, but particularly in late life, who have experienced the loss of a loved one, develop prolonged grief. It's as if the work of grief is somehow sidetracked and they become stuck, as it were, in the throes of acute grief, unable to come to terms with the loss of a loved one, unable to reimagine and undertake a life without the loved one, to find meaning and pleasure and satisfaction in a life without the loved one that they have lost. I refer you particularly to DSM-5. You will find in the appendix in section 3 provisional criteria for persistent complex bereavement disorder, PCBD. And I would refer you also to ICD-11, where you will find diagnostic guidelines for the assessment of people living with prolonged grief disorder. The essence of prolonged grief disorder is persistent yearning and longing for the person who has died and intense preoccupation with the circumstances of the death and intense emotional pain. Of relevance to this series of talks is the fact that prolonged grief disorder frequently co-occurs with major depressive disorder, but is not the same thing as major depressive disorder. It also frequently co-occurs with post-traumatic stress disorder. I'd like to refer you to what I think, if you'll allow me, will be a landmark clinical trial, a multi-site NIMH-sponsored clinical trial of complicated grief psychotherapy. That study was published in 2016 in JAMA Psychiatry and showed the superior efficacy of complicated grief psychotherapy with or without citalopram for the relief of the symptoms of complicated grief. Patients who were randomly assigned to supportive care with or without antidepressant medication with citalopram did not do nearly as well as those who received complicated grief psychotherapy. What was particularly interesting to me as someone interested in the diagnosis, and I've been involved with the DSM process for many years at this point, is that depression-specific treatments such as IPT or antidepressant medication simply do not do nearly as well in the setting of complicated grief as does the depression-specific psychotherapy developed by Kathy Shear for this condition, complicated grief therapy, or CGT, that is sometimes called. I'd like also to give a shout out here to my colleague, Holly Priggerson, who developed the Inventory of Complicated Grief, the ICG. The Inventory of Complicated Grief remains the industry standard, if you will allow me to use that phrase, for symptomatic assessment of complicated grief, as long as the symptoms are assessed 6 months or longer after the death of the loved person. Scores typically of 30 or above indicate its presence, particularly, or I should say only in someone who is at least 6 months after the loss of the loved one. The DSM and the ICD do not support the diagnosis of complicated or prolonged grief until at least 6 months after the loss, and in keeping with normal variability in the course of grief, as well as with the cultural mores that determine the expression of grief. The point that I would like to make before closing out this section with respect to depression in the context of terminal illness is that there has been, I think, an increasing interest in the use of psychostimulant medications such as methylphenidate to promptly relieve the symptoms of depression in patients who are dying or in whose death is imminent, allowing them to have a more comfortable passage and perhaps thereby as well to engage with loved ones in the process of saying goodbye. There's also a large literature on the use of other types of specific counseling, particularly those that address life's meaning, issues of gratitude in the life that one has led, and other spiritual types of issues. So to summarize key points, I think in what is a very interesting and frankly very complex area in psychiatric research, we have learned that prolonged or complicated grief is distinct from depression, very much distinct from depression in terms of the types of interventions that it responds to. Frequently is accompanied by major depression in older adults as well as earlier in the life cycle, and occurs in about 10% of persons who have lost a loved one, whether it be a spouse or a child, an off-time loss. And it is a particularly difficult issue in patients who have lost a loved one to suicide or to homicide. Prolonged grief can be assessed well with the Inventory of Complicated Grief, the ICG, at least 6 months after the loss of the loved one. The ICD-11 allows flexibility on this point in different countries and in different cultural settings, because in some countries and settings, it may be inappropriate to diagnose a complicated or prolonged grief until at least 12 months have passed. Prolonged grief disorder responds well to a specific type of CBT-based treatment called complicated grief therapy. And finally, depression in the setting of terminal illness may be alleviated by the use of psychostimulant medication, allowing the passage to be kinder and gentler, allowing the patient to say goodbye or to engage briefly in more spiritually oriented forms of counseling. Thank you.